those rates of heart disease. So this is not observational studies. This is very clearly carefully controlled, and it's genetic research, which I don't know how you can say that that's observational. So, I mean, would you concede that LDL is going to relate to heart disease at this point? So I'm showing you the evidence here.
There's definitely an association, but again, I'm not sure, like, for example, there could be, you're talking about a genetic defect, then what if that genetic defect that also causes the heart disease also causes the high cholesterol, right? But it's not necessarily known whether the high cholesterol caused the disease, right?
You're trying to say that it's reverse causation, but it's not reverse causation because we have these LDL raising and lowering alleles genetically. And yeah, and so basically we can look at the proportional reduction in risk and we can intervene. We can actually do an intervention. And we can keep all other factors consistent and we can lower cholesterol, whether by diet or by drug. And there's a proportional reduction in risk based on the dose-dependent amount that you reduce it. So it's not going to be that it's reverse causation. It's not going to be that, well, maybe it has nothing to do with it. It's just correlating along with it. We're talking about interventional studies here where they actually do intervene. And I can show you the criteria they use here for causation, because this study is a comprehensive look at the evidence, not just one study. They're looking at many meta-analyses of studies. So I can read some of the criteria they have here. So they have the criteria they have. Let me just read this though. The criteria they have is plausibility, strength, biological gradient, temporal sequence, specificity, consistency, coherence. So LDL, so they have 200 studies involving more than 2 million participants with over 20 million years of a follow-up, with more than 150,000 cardiovascular events consistently demonstrate dose-dependent log linear association between the absolute magnitude of exposure to LDL and risk of heart disease, basically ACCVD. And they have Mendelian randomization studies, randomized interventional trials, all show dose-dependent log linear association. And so the longer the exposure to LDL, the higher the risk. And you can modulate this risk by intervening with drugs or diet. And so there's 30 randomized trials here, 200,000 participants, 30,000 cardiovascular events, evaluating therapies based on lowering LDL. So that's like statins, PCSK9 inhibitors, stuff like that. And they all reduce LDL and reduce the amount of heart disease you get from the exposure. So it's not going to be that this is not an association study. When we're talking about Mendelian randomization studies, there's not going to be something like, it's very unlikely for it to be reverse causation at this point when we have interventional trials and we have Mendelian randomization studies. This is it's not an epidemiologic study. And in fact, it's a huge data set of data on this topic. And again, this is the scientific consensus. This is not just me saying this. This is, 22 international organizations. They all say that you want to have your LDL low to prevent heart disease. So, I mean, I think that there's no criteria that you can use to say that this is just not a thing or something like that. I mean, it's clearly causative. And I gave you the criteria for causation that they use. You can read them out. Are you there?
Oh, sorry, I'm not used to push to talk. I was talking and then it didn't say anything. So those are all really good points. It at first glance, it definitely looks like there's a strong correlation, and there is a correlation, as you've just proved. And you're saying that, since we can give these people intervention drugs, such as, I'm assuming the most popular one is statins, as far as I'm aware, you can see that their risk goes down. And I mean, anyone can see that the risk for disease does go down when you give them statins. But as you can see, I'll link you a study, for example.
Could see what?
So as you can see in this study, for example, it's not necessarily the cholesterol level in the blood, although it is always there because, as you can see in the fourth, well, okay, so first of all, in the fourth paragraph of that article I studied, you can see that as they give statin not only has the effect of lowering cholesterol, but it has the effect of lowering the development of, let's see, endothelial dysfunction. It promotes plaque stability, and it modifies your inflammatory response in your veins, as well as also modifying the way thrombose formation. I'm not very familiar with that, but from what I'm reading, it's pretty clear that it's not just an effect of lowering cholesterol, and it could be all of these things. Now, for the sake of time, I'm going to say that, okay, maybe, obviously, your cholesterol shouldn't be way different from normal. So if someone has a way too high amount of anything, that's not good. And so, yeah, I wouldn't say, oh, if you have really high cholesterol, don't worry, you're totally fine. I wouldn't say that at all. I mean, as this article shows, it is, and your articles show, it is very well correlated. But now, so you might say, oh, that's an argument against eating meat because wouldn't meat raise your cholesterol levels? And that's another thing.
We can go there. But first, I just want you to concede the point that if it was the case that meat did raise cholesterol, right, then there would be a probable chance that it would increase cardiovascular disease risk. And again, I've already shown that it does, but I'll show it again. But anyways, the point here is that I've given you the criteria that they used for evaluating causation. You keep saying it's an association. It's not an association. They're evaluating causality here. So this is not an association. And so the criteria are here. Criteria for causality, low-density lipoprotein, atherosclerotic cardiovascular disease. This is not just one study. I gave you another one, Mendelian randomization studies, again. So when we're looking at Mendelian randomization studies, they're not association. That you have to understand that. We're talking about genetic factors that either increase or decrease cholesterol. And we know that these people have had that they've had either high or low cholesterol their entire lives because of this genetic factor. And as it turns out, even people who smoke, even people who have terrible diets, if their cholesterol is kept low with these genes, then they don't have this high risk. They still have a modulated risk that's lower. So it can't be the case that it's going to be, it must be something else correlating alongside cholesterol. It's going to be the case that it is the cholesterol that's doing it. And we can get into what the specific amount of cholesterol that we should have to be normal. Like what cholesterol is technically physiologically normal. And that's what the evidence shows is it's going to be around 50 to 70 milligrams per deciliter. Above that ratio or above that level, you're going to see the progression of atherosclerosis. We have a lot of evidence for that. So there's 2 large meta-analyses where they look at multiple converging lines of evidence. I can show you one of the charts for one of them here. Let me see.
Hold on, just 1 second though. So, I mean, you were talking about the scientific consensus. So then in the article I linked, why does it say that the prevailing evidence is not supportive of that hypothesis, that cholesterol is a risk factor for stroke?
That's a totally different issue. We're talking about stroke. I'm talking about cardiovascular disease in terms of atherosclerosis, first of all. And the second thing is they could be looking at their own data. I haven't read through this study in depth, but what oftentimes they do is they're not going to evaluate the entire literature. They're going to evaluate what they used in their own criteria. So they're going to look at various studies that they polled, and they're going to say these studies that we polled did not find an association with X and Y or whatever it may be. But again, it's kind of funny because what kind of study is this? Is this a association study? Like you just told me not to link those and then you link one? What is it?
No, I didn't say not to link it. It's just that I was contending that the scientific.
No, but here's the thing. Here's the problem, right? I just linked Mendelian randomization studies, meta-analyses of, yeah, and Sovereign's saying it's an editorial. I haven't even looked in depth at it yet, but I'm linking Mendelian randomization studies and randomized trials of like interventional therapies where they like modulate risk, and then you're linking me an editorial of like a prospective study, and it's like you just used your own criteria against yourself. You just said, don't send me a study that's an association study because they tend to not be accurate, and then you send one yourself. So and again, so do you see this picture I just referenced here down here in the bottom? Are you in the debate VC text here? I just sent a picture.
Yes, I'm looking.
Yeah, so what we see is that this is from a large paper from 2017, American Journal of Cardiology, where they looked at LDL in atherosclerosis, and they looked at what level is required to progress the disease. And they found that if your cholesterol is essentially over 60 milligrams per deciliter, around there, you have a progression. Whereas if it's below that, you don't have a progression. So the fact that this is corroborated by many converging lines of evidence is just damning evidence that cholesterol is a very strong, at least very strong risk factor, and it is causative in this case. You can read the paper for yourself. I linked it here. Low-density lipoproteins cause atherosclerotic cardiovascular disease. Read that. There's another one here I linked, Mendelian randomization studies. Going over those, talks about irrespective of the mechanism by which cholesterol is lowered, there is a benefit, a huge benefit to that.
Sorry, could you link the paper in which the picture came? Oh, thanks.
It's right at the bottom here, but I will link it. I don't know, Sovereign, can you link this one? I have it here somewhere, but he knows which one it is. But anyways. And this one is, again, another one, effective long-term exposure to lower LDL. And so, again, there's a dose-dependent response. So the longer you keep cholesterol low, the lower your risk. And if you increase that, your risk goes up. You decrease it, your risk goes down. And again, your hypothesis that there's something else correlating alongside that just doesn't follow, because, again, Mendelian randomization studies, we know that even people who smoke cigarettes or do these, do horrible diets, they still have that risk reduction. And the thing that's genetically there from birth. It's based on like alleles.
Right.
Mendelian
stuff. So I haven't read through the Mendelian random study. I mean, obviously I didn't have time in which the time you just linked it, but do you know whether they control for inflammation in the blood vessels?
Yeah, well, I mean, presumably there's going to be people who are like, these are just regular people. They're not vegans. They're not this and that. It's like, it's going to be people who are smoking cigarettes. And I mean, it's going to be people who are eating just bad diets, bunch of sugar, whatever it may be. And yeah, they're going to have inflammation and things like that. But the thing that's correlating with heart disease in this way is always cholesterol, no matter which way it goes. And there's a common thing that people will say is that, well, maybe it's they'll point to a observational study that shows that higher cholesterol can prevent lowers mortality or something like that. But the problem with that is that it's going to be reverse causation, because it's not a Mendelian randomization study. It's not a randomized trial. It's a prospective cohort. They're not tracking things well enough. And as it so turns out, there's things that can actually lower cholesterol. And that can, like, if you're sick, if you have chemotherapy, if you have cancer, that can lower cholesterol in itself, or losing weight, that'll lower cholesterol. So again, if that's the case, right, and you're saying, well, people with low cholesterol are dying more. I'm not saying you're making that claim, but I'm just saying if you are going to go there, it's going to be reverse causation, because we know that when these people are controlled for in Mendelian randomization studies, like old people, we don't find that. We find that there is an association, because there are things that can lower cholesterol But again, when you control for that, that disappears. So here's one